friends, this is Adira Rajendran from Bliss Institute, Sharjah, and today I am going to discuss some emerge questions, Sharjah emerge question. As already you know, we have 100 questions in the exam and almost 85% of the scores or 85% of the questions should be right, then only we will pass the exam. And now I am going to discuss some recent questions. The latest question paper, we can have a look on this. And the first question we are going to be discussing, it is regarding hyperglycemia. It is a usual question, so every question paper this will be repeatedly coming. And the sign of hyperglycemia, they have given an option, it is blood vision. So if it is there, you can choose that, it's a good one. Then second question we have asked recently, it is regarding Clostridium difficile, and this organism which is found in soil, and usually we have to maintain hand hygiene. So pico oral route, it is a transfer. So standard contact precautions. So there is an option regarding this. So we can maintain standard contact precaution for this. And another question we may have from this is acute renal failure electrolyte. So acute renal failure electrolyte, so that is hyperkalemia. So potassium levels will be elevated in acute renal failure situation. So there is an option hyperkalemia as well as high potassium level. So whether two comes, anyone you can choose, and only once they have given. Then next it is regarding some procedures, so that is donning. So wearing PPE, it is called donning, and they have given an option regarding GMGG, that is a short form. GMGG means gown, mask, goggles and gloves. So if check whether it is there, sometimes they have given first hand wash, then gown. Check which one is the option, then choose GMGG. So that is your right answer. Then another question, it is gas forming food. For practical nurses as well as registered nurses, they will ask regarding this gas forming food items always, and they will give an option cabbage. So for both nurses, both practical and RN nurses, you can choose this cabbage, and both options it will be there for you. Then another one, something related to esophageal disorder. So SI, they are going to be asked regarding this esophageal disorder will come. Then this is dysphagia, and the last question paper they have given option regarding dysphagia. One more it is there, odynophagia. So whether which comes, you can choose that. If it is dysphagia are there, you can choose that. Otherwise odynophagia will be the best option for you. So you can choose that one. Then a regular question which is regarding hip replacement, another name. So it's absolutely arthroplasty. So this will be an option. And coming to phobia. So some psychiatric questions you can expect, especially from phobia, and you can expect for children as well as the adult. Once if phobia comes with children, some diversional activity, maybe they will give direct name diversion, or otherwise they will give some examples regarding some games and all. So simply we have to recognize that it is a diversional technique, and finally we can choose that once if it is given as a child or children. If it is coming to an adult, you have to choose another methods. So that is first of all desensitization. So gradually we have to expose the adult with the phobic situation, and we will explore that. So the thing which we have to focus with is desensitization in adult, and the same time child we can manage it with the diversion. So this is the main thing you have to keep it in mind regarding this phobic management. And then another one regular question is from inhaler technique. So usually a scenario you may get regarding asthma, and the technique which the patient can follow by using inhaler. So usually there is option from mouth to nose. So maybe nose to mouth, something like that will be there. But the best one it is from mouth, not nose. So exactly you can see whenever you are going through that question. Then another one, which is purposes of cold lavage. Actually, we are giving cold lavage when the patient is expecting some kind of bleeding, so internal bleeding. And once we are giving this cold lavage, it helps to avoid bleeding, or vasoconstriction will be there. Thereby, bleeding will be stopped. So this cold lavage purpose they have asked. So you can say that it may be due to some kind of gastric problem. So constriction of vessels will be occurring at this moment. Then another question you can expect, commonest disorder in elderly people. So respiratory tract infections are more common in elderly. Some scenario basis you can expect this question, and the most suitable option they are given in that is pneumonia. Pulling of secretion causes this kind of pneumonia, so you can choose that option as well. Then two more questions we can discuss today itself. And regarding some nursing priority, post-operative nursing priority. So always whenever a patient is going for operation, first we may have given priority for airway clearance. So one nursing priority they will ask you. So ineffective breathing pattern, they will give an option. So you can choose that one. Okay, so this is the one ineffective breathing pattern. And the last question, one more information I can give you regarding eardrop administration. So this eardrop administration, it is also a usual question. And first of all, you can warm the solution, then pour from side of the ear canal. So there is an option like this. So one of the important questions you can expect from eardrop administration. So always warm, because we have to make the core temperature of the ear. So eardrop administration, warm the drop, then pour from side to ear canal. So these all are the few questions in the last question paper, in this month. So I think this will be a useful thing for you. And always keep watch on our videos. And for any queries, you can contact our WhatsApp number or as well as direct calls. So we will clear you always. Thank you for listening.